Now let's kind of dive into the stigmas of mental health, right? I'm going to also tag along with a substance use after a traumatic incident.
Okay.
So the stigmas around mental health we touched on a little bit.
Hmm.
The one thing, and you brought up a good point years ago when we talked about it, and you talk about it a lot, is not adding substance. A lot of it, a lot of times ends up being alcohol, right? After a traumatic incident and the effects that it has on the brain, being able to process that stuff. So if you could dive into that a little bit, you know, so people can understand, what I understand now, what a lot of other people that you've talked to understand,
Yep.
and how it has that effect.
Sure. So I always say I'm not the alcohol police. I'm not the cannabis police. I'm not the substance police. Um, it's really not, it's looking at differences. So if you have somebody who has, for example, always done a six pack every week and that's their average, and now they're averaging a 30 pack or a bottle of bourbon or something else, then something's going on, right? It's not necessarily the fact of use, it's the fact of the increase in use over time because of something. And a lot of times we are trying to feel better, right? Because let's face it, alcohol helps us sleep at the beginning. It helps tone our body down a little bit. It helps relax us. It helps us get to sleep. So after an event, it often will help us sleep for a little bit. The problem is if you go back to the EMDR and the REM sleep and just trauma in general, and trauma uses a big word across the board for anything. Like I said, you can get a fight over the dishes. But if our brain is not sleeping properly because it's induced with a substance, then it's not going to heal the way it needs to. So, although the alcohol, the cannabis, or whatever else is helping us fall asleep, it's not still processing and fixing the things properly because it's being embedded and induced with something else. So, what they're saying now that they've found is that if after an event, you can actually withstain from having the substance, whatever the substance is. If you can withstain from it for about 3 to 4 weeks, you have a significantly better chance of never having symptoms and definitely have a significant decrease in having PTSD. So, a lot of times we're trying to teach people now through peer support and through wellness and all these things that we're doing, especially here across Connecticut, on decreasing the use, especially after an event, increasing the happy use of things, of positive hobbies and positive activities, and all sorts of things that some people think is just foo foo and doesn't matter, but will actually help you heal. And then you want to go back and have your booze in a couple weeks.